Hello, and welcome to the Alliant Health Solutions Making Healthcare Better podcast. My name is Rukia Campbell, and I'm your host today. As a number of older adults with chronic medical illnesses and substance use disorders, and especially opioid use disorders, increases, so does the need for post-acute care services in skilled nursing facilities. So today on the Making Healthcare Better podcast, we'll chat with Dr. Swati Gaur. Dr. Gaur is Alliant Health Solutions medical director, and she's also a practicing physician who specializes in geriatric medicine. So today, she's going to share some insight about what nursing facility staff need to know about managing substance use disorders. So thank you for joining us today, Dr. Gaur.
Thank you for having me.
So we'll get right into it. So how do you define substance use disorders?
So substance use disorders is defined as a treatable mental disorder that affects a person's brain and behavior that leads to their inability to control their use of substances like legal or illegal drugs, alcohol, or medications. Symptoms can, of course, be moderate to severe, with addiction being the most severe form of substance use disorder. I think I want to make sure that I stress here that it is, first of all, treatable, and it is a mental disorder, which is a chronic illness, which is very similar to other chronic illnesses that people may have, like hypertension, diabetes, etc.
That's really interesting. I'm glad that you mentioned that because a lot of people probably don't think of it as that. So that's good to kind of lay that groundwork for us.
Mm-hmm.
So why is this an important topic to discuss right now?
Yeah, well, many reasons, right? One of them is that substance use disorder may be occurring. There is a very good percentage of population who have substance use disorder, but also other mental health disorders, and vice versa. So it is important for us to be able to make that diagnosis or be able to recognize that those two may be ongoing together, and be able to then manage both those disorders, because you can't treat one without the other, and it is important to recognize both. The other important thing that I want to bring up here is these substance use disorders can affect anyone, regardless of race, gender, income level, or social class. It is basically ever pervasive right now in our society. In fact, the numbers are astounding. You know, these numbers have increased exponentially lately. In 2020, 40.3 million people age older than 12 years were diagnosed with substance use disorder. That's almost 15% of this population. That means 1 in 7 people will have a substance use disorder age 12 years and older. That's a huge number of people having that problem. So it is incredibly important to be able to recognize, you know, this issue. Imagine, right, if 1 in 7 people walk around with undiagnosed or even partially diagnosed, diabetes or hypertension.
Mm-hmm.
That's almost, that's so hard to imagine and digest, right? Similarly, substance use disorder, which is a chronic medical problem, is that prevalent? So it's very important to discuss this. In long-term care settings, so I'm a medical director for long-term care facilities, and in long-term care setting, we just need to recognize that we take care of, the same population that we just talked about, right? Overall population. We are caring for people from different walks of life. And as the substance use disorder prevalence increases in general population, so does the prevalence in people who are coming into the long-term care facilities. So not being able to either recognize, diagnose, or manage these disorders can really put our residents who are coming into the long-term care facilities at a disadvantage. It may actually make it worse unwittingly, right? Let's take an example of a person who is in treatment as an outpatient. They possibly, I don't know, break their hip and end up in the hospital and are now on medications, and there's no recognition or awareness of long-term care facility staff that they were in treatment. These treatments could be behavioral therapies as well as medical treatments, and a lot of times you're going to we are going to be treating them for, let's say, pain, right? When they were already either being treated with a different medication outside for opioid use disorder or substance use disorder, and now our pain medications that we are using are unable to treat their pain, and we kind of go back into that narrative of right, this person has substance use disorder, they're medication seeking. On the other hand, what is going on is the substance that they were on, it was so tightly bound to the receptors in the brain that the increasing dose of pain medications that we were giving were not doing anything. They were not able to go and match with those receptors because they were already blocked. So, we see a lot of these issues that could potentially just, um, really make a negative impact on the people who are already either getting treatment or people who may not know to seek treatment as well.
Wow, wow, that's a huge, huge issue. And so it's interesting, like you said, that more and more residents of long-term care facilities are being sometimes diagnosed, sometimes not diagnosed with substance use disorder, but they're experiencing that, but it's not being given enough attention. So that's really important as to why we're talking about this today. So knowing that that's happening, what are some specific examples of what's happening in these long-term care facilities that's making this a hot topic right now?
Yeah, so I think, one of the things, clearly, we talked about some of this in the previous, question that you asked. Recognition is important because we ought to be able to treat substance use disorders similar to how we treat diabetes and how we treat hypertension. Moreover, I think it is very, very important for staff in long-term care facilities to recognize we cannot and should not refuse treatment to our residents, or refuse even admission to residents who are coming to us, the referrals that we are getting for, caring for people. People should be coming in to long-term care facilities if they are appropriate to come into the long-term care facilities according to their needs, right? Any kind of diagnosis should not preclude long-term care facilities, from admitting people into long-term care facilities. So I think I want to make that very, very, very clear is nobody should be refused admission into a long-term care facility based upon the diagnosis of substance use disorder. So that is number one, important thing.
Awesome. Awesome. So
Yeah.
why is this happening more often? What are some of the specific issues that are preventing facilities from providing better care, preventing them from admitting those that have substance use disorders?
Yeah, well, I would say the number one issue is what we don't know, we are afraid of. And I think, this is something that, we see very, very, very often. And, even in, in medicine, right? When I do not have a good idea on, or I don't have the competencies developed on treating a particular illness, I am hesitant to treat that, right? And then once you get that training, once you get that knowledge, you get more and more and more comfortable and less scared or worried or, avoidant of that particular issue. So I think developing competencies is an important part of being able to treat the substance use disorder. The other important thing is, we kind of, in all healthcare, but also in long-term care facilities, we kind of live in a reactive environment, right? Even in, chronic disease processes, if you compare it to, like we talked about, hypertension and diabetes, we are always kind of trying to treat, and it's kind of taking a step back and being able to recognize these disorders is important, right? So it's not like when we have a crisis, we don't want to jump from one crisis situation to the other. But we need to kind of step back and say, let's look at the person as a whole, and how one thing is interrelated to the other, and be able to diagnose these substance use disorders, and be able to create a holistic plan in management of that. The other big barrier is siloed system of care. We talk about fragmentation of medical care. It's 100 times worse for mental health services. They may be getting treatment from the outside provider. They may have, substance use disorder being managed by an outside clinic. And oftentimes there is either no recognition or no, collaboration with the long-term care services. There is clearly lack of behavioral therapies. Some of them are payment issues. But, having the siloed environment in different payment systems precludes us from, creating a holistic plan to be able to do that. But I think the number one issue, again, is the lack of knowledge and competencies that we may have in long-term care facility staff.
Yeah. It's interesting that you say that, because we actually have an organization called the Center of Excellence for Behavioral Health and Nursing Facilities that's actually co-hosting for this podcast session today that we're having. That organization actually hosts monthly sessions on this topic, and it's absolutely free to people that work in skilled nursing facilities. So we as an organization, as Alliant Health Solutions, in partnership in collaboration with the Center of Excellence for Behavioral Health and Nursing Facilities, are really proud that we're able to support nursing facilities in that area. So anyone interested in getting some of those free trainings or getting access to that. And also I should mention that continuing education credits are offered for those trainings as well. And it's totally free, complimentary. Feel free to go to the website, nursinghomebehavioralhealth.org. So all of this information has been really insightful, and hopefully will provide some perspective to our listeners about what's happening in the nursing facility and substance use space. So now that we've covered the barriers, we're definitely going to need to explore some solutions. So to those listening, be sure to tune in to part 2 of our conversation with Dr. Gaur, as she shares some possible real-time solutions that nursing facilities can implement right now to address their challenges in providing care for residents with substance use disorders. So I thank you so much, Dr. Gaur, for your time today. And to all of our listeners, we look forward to seeing you in part 2. Thank you for listening to Alliant Health Solutions, Making Healthcare Better podcast.